Did you know that if you have a spinal fusion, it's more likely that you're gonna have problems after that fusion than that you're not? Hi, I'm Dr. Chris Gubbels. I'm a leading authority in the non-surgical treatment of scoliosis and hyperkyphosis. And in this video, I'm gonna cover the most common problems that people have after having a spinal fusion. First of all, I wanna say I'm not completely anti-spinal fusion or spinal surgery. There is a time and place for spinal surgery. I myself have had patients that were not candidates or did not 100% respond to conservative treatment that actually needed surgery. But when possible, we always want to do non-surgical treatment options first. In fact, I remember talking to one of the most well-respected spinal surgeons for adult spinal deformity in our entire region. And his group has actually published more research on surgeries for adults, on adult spinal surgery, than any other organization in the world. And we were talking about surgery for potential patients. And he told me he actually does not frequently do surgery on new patients. And what I mean by this, he said 85% of all the surgeries he does are revisions, meaning he's actually redoing or repairing problems from a previous surgery the majority of the time. And the reason for that is there are so many people that have spinal fusions that have new problems or continue to have their old problems after an initial surgery. So in today's video, I'm going to cover the most common problems that people have after having a spinal fusion surgery. So let's dive in. Now, one of the most common problems after a surgery is called a pseudoarthrosis. This is actually what's known as a non-union of the bone. Basically, this happens after a spinal fusion or a surgery where the bones do not heal or reform properly. This happens a lot of times in a spinal fusion where the actual fusion doesn't properly fuse to the bone and it doesn't attach properly. Now, there are many reasons this could happen, but this is a problem that's going to need to be addressed and frequently leads to a new or re-operation. Another common problem that happens after a spinal fusion is having an unbalanced spine. Now, when we look at the spine from the front, you should be straight. The top of your upper thoracic or lower cervical spine should be lined up right over the center of your sacrum or pelvis. When we viewed from the side, that same area, your last or lowest cervical vertebrae or your upper thoracic vertebrae should line up right over the back of the sacrum. When viewed from the front, this is called coronal balance, and when viewed from the side, it's called sagittal balance. Now, a lot of times people with spinal problems have a coronal or sagittal imbalance. But after surgery, one of the goals with surgery is frequently to actually try to improve or correct these imbalances. But many times after a surgery, the spine can remain unbalanced. And when you have an unbalanced spine post-surgery, that's a person that's likely to continue to have problems or complications from that surgery. So having an imbalanced spine post-surgery is one of the problems that you may have or something that may continue to cause problems post-spinal fusion. Neurological injury. This is a scary one. This is one that people are often most concerned about. And this is someone that has a neurological injury or trauma from the surgery itself. This could be to a spinal cord injury or one of the nerve roots being injured itself. This may result in having chronic radiating pain or possibly some kind of radiculopathy, maybe even neuropathy-like symptoms. A neurological injury could cause a loss of limb function or a decrease in limb function. So it's definitely not something that you want to have happen, and it's typically a result of something being done wrong or not being done properly with the surgery. And if you have neurological injuries following a surgery, that's something that may or may not be able to be addressed or fixed post-surgery, meaning that could be a permanent injury. 4, degeneration of an adjacent segment. This is actually known as adjacent segment disease. You see, all your spinal joints are designed to move, and joints need to move to function properly. But when you fuse or immobilize a section of vertebrae, the vertebrae above and below the fused segments have to make up for all of that movement. That puts excessive stress and strain on those joints, and it causes the joints above and below to tend to break down and decay. There's actually an ICD diagnostic code for this called adjacent segment disease. So one of the problems with spinal fusion is it puts excessive stress on the joints above and below the fusion, causing them to potentially break down and wear out much faster, which may lead to additional surgeries or additional fusions. 5, infections at the site of the fusion. This may be the biggest complication or the most common complication of surgeries in general, but having an infection at the site. I remember one of my employees' husbands had a complete spinal fusion. And after the surgery, he seemed to be doing good for quite a while, but he started to have pain that progressively increased after the surgery. After doing a more detailed evaluation, he had developed a deep infection at the site of the surgery. I had another patient that came to see me after having her spinal fusion removed because of the severe infection the patient had. Now, this was a surgery that was actually done on an adolescent patient, but when they removed that hardware, the patient completely collapsed. And the only possible solution was to do a new surgery. But you can imagine the fear in the parents of having to face doing another surgery after the first surgery went completely wrong. I don't know what happened to the patient because by the time the patient got to me, that patient was too severe to treat with non-surgical treatment options. 6, proximal junctional kyphosis. I had this today. I had a patient actually called me that had this going on post-surgery and was asking if I could make a brace to support their spine. Now, this typically happens when someone has a fusion in the lower part of their spine, the lower thoracic, or in the lumbar spine. When you look at the curve when viewing the spine from the side, the curve in the mid-back is called a kyphotic curve. Now, normally when you view your spine from the side, you should have a nice normal curve in your lumbar spine, your low back, a curve in your mid-thoracic spine, and a curve in your upper cervical spine. So a proximal junctional kyphosis is when something happens where when the curve in your lumbar spine, where that normal transition is from the lordosis to the kyphosis, where that changes. And then a proximal junctional kyphosis, you actually hunch forward at the wrong point, and the patient will actually start to bend and lean and hunch forward. So when that happens, the only possible treatments are to do an additional fusion where you fuse the rest of the spine above, or potentially do some kind of custom kyphotic brace to support the spine. Another possible complication is the continuing progression of the curve or the problem. Just because you have a spinal fusion doesn't mean the spine is actually fixed, and you may continue to have problems. So just because you have a surgery for a problem doesn't necessarily mean that problem is going to be resolved, and you may continue to have problems, and that problem may continue to progress. And the 8th possible complication is having reoperations. Over 50% of all surgeries actually require a revision or a new potential surgery. Now, how common are these complications? Well, 50% of all surgeries have some kind of complication with it. 30% of patients that have a spinal surgery for an adult spine deformity require readmission, and 12% of patients that have surgery for an adult spine deformity require an additional surgery within 5 years. Now, if you're watching this and you have scoliosis or hyperkyphosis and you have degenerating spine and you're trying to figure out what to do, I'm going to encourage you to click on the link below and request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis or kyphosis, how severe it is, how likely it is to progress, and most importantly, what non-surgical treatment options are available to you. And all the scientific literature that talks about treating spine deformities like scoliosis and hyperkyphosis, it's always recommended that you only do surgery once you've actually exhausted all non-surgical treatment options. In fact, many times a requirement for surgery to be covered by your insurance is to have failed the non-surgical treatment options first prior to doing surgery. You see, the goals of surgery are the same as the goal of non-surgical treatment options. That's to decrease pain, stop progression, and improve quality of life and improve appearance. And if the goals of the non-surgical treatment are the same as the goals of the surgical treatment, you should always try the surgical options first. After all, if non-surgical treatment options fail, you can always end up doing surgery. But once you do a spinal fusion, you have that fusion for life and there's no going back. Not saying it's not needed, because sometimes surgery is needed. Now, to learn more about the most effective non-surgical treatment options for scoliosis and hyperkyphosis, click on our link for the next video, and I'll see you there.